Welcome to the From Guilt to Good podcast, where we discuss all the things caregivers wish people would talk about, but they don't, won't, or can't. Hi, my name is Jeanette Yates. I'm the founder of The Self-Caregiver. I cared for my own mother for several decades and now help caregivers set boundaries and use simple tools that make care and life easier so they can feel good, not guilty. And today's guest brings a truly unique perspective on our conversation. He not only is a seasoned healthcare executive, but also a hands-on family caregiver to his mother as he navigates all of those real challenges that we face every day. Lon Hecht is the CEO of Care2U, a company that delivers high acuity care directly into patients' homes in place of the ER or the hospital. You heard that right, and we're going to get into it in a minute. With over 25 years of experience in healthcare, Lon has spent his career building and scaling some of the most forward-thinking healthcare models in the country, with a particular focus on home and community-based care. But outside of the boardroom, Lon is a son, currently supporting his mother through her own healthcare journey in an assisted living community. That personal experience gives him a perspective that goes far beyond his resume. He understands the emotional weight, the difficult decisions, and the gaps in the system that caregivers face, because he is living it too. And I'm so excited, Lon, to have you here. Thank you so much for joining us.
Thank you, Jeanette. Excited to be here.
I always start off by just inviting our guests, whether they're caregivers or professionals like yourself or both, just to share a little bit about your personal caregiving experience, where you are with that, and just let you talk a little bit about, so we get to know you as a caregiver too.
Sure. So it's been a little bit of a whirlwind. I would say my mother over the last several years has started to notice some decline, some cognitive, and I'll kind of leave it there. But then there was a little bit of a rapid period when I was on vacation with my daughter. We were doing an adventure vacation out in Costa Rica, and my mom had a bit of a steep decline. And I got a call from my wife, and we tried to cut that vacation short, and I came home. And things changed very rapidly. That was back in December. So it's been quite an experience. Really, things picked up quite a bit. Good news is we actually were able to kind of stabilize things. She lived with us for about a month. We got her into a wonderful assisted living community, and just the right diet and medications and things like that have seemed to stabilize and put her actually significantly better than she was. But it is a challenge. And I will say that every day is a different day. So right now I'm going through that journey. I'm an only child, which brings its own challenges. My mother had lived over an hour away. Now she's living about 20 minutes from us. I had to put her a little closer to her family rather than directly out by me. And I felt like the community was perfect for her because my mom is a real salt of the earth kind of person. And out by me, it's a little bit different out where I am here. So I wanted her to be in a place that she felt really comfortable. So that's a little background on the experience so far.
Well, and I already thought of like 4 other episodes that I could do with you, because there is finding the right place and balancing your like closest to me versus in a place that she would feel good. So there's that aspect of things. And then of course, the first thing you said really struck me, because I know what it's like to go away and then have something happen. Right. I was caring for my mom for such a long time that, there were some times where we didn't even think about it. We would just go on vacation and everything was fine. But then like as the year, as things started ramping up or winding down, however you want to talk about it, it was always like, how far can we go? How hard is it for me to get back? That kind of thing. So I totally understand that as well. And then of course I'm an only child too, so I get it.
It adds a layer of complexity. I always tease my kids. I was moving my daughter into her new apartment this weekend with my son. And I was just like, remember guys, I know this is a pain right now helping each other out with the move, but remember there are 2 of you to take care of me when you're older, not just one of you. So these moves aren't so bad, because on the back end, you're going to be really happy to have each other.
Right. Yes. And hopefully that'll be, because I speak to people, caregivers all over the country, and the ones that have siblings are like, oh, it must be nice to just be by yourself making these decisions, because they having to go through the committee. But then the people that are like me, they're like, I wish I had somebody else to talk to about all this. So
I guess it all depends on how helpful your siblings
yes,
right?
Yes. But you're prepping them well. You're prepping them well. So, all right. So we were messaging back and forth on email, and I am so excited for you to talk about Care2U. Tell me how it started, and then we'll talk a little bit about what it is, and then of course what it isn't. So,
Yeah, sure. My company that I'm a part of is Care2U, and number two, letter U. And what we do is we provide high acuity care in the home. So think of this as bringing ER and hospital level care directly into the home, typically within 2 to 4 hours of a call. So we send a clinician into the home. They work up the patient. They then bring on another physician via telehealth. So you actually have two clinicians in one visit, and they work on the patient and the care plan together. If we could treat them in that one visit, that's wonderful. That is an
mhm,
ER visit avoided. But if
right,
they need ongoing care and they meet the right guidelines and are appropriate for being able to be technically, I wouldn't call it hospitalized because we're not a hospital, but I would
right.
say receiving hospital level care at home, we can admit them to our service directly there and we can see them for that episode. So
Mhm,
we're not primary care. We're nothing like that. What we do is we step in for what you would call episodic care when they have a flare up, something, it could be like a congestive heart failure exacerbation, COPD, pneumonia, different things like that,
mhm.
complicated UTIs. We can come in and we can manage that patient in the home very comfortably. The one thing I'll say is right now we're in the New York market. We're actually about to raise some additional funding to move into other markets. So I expect us to be in maybe 3 or 4 markets in the not too distant future. But the odds are there would be care like this available in your area and in your community. So I think it's one of those things that's really relevant to everyone. I care more about educating the market that these kinds of
Mhm.
services are available than I do about this being about Care2U.
Well, and I also think even if it's not available, it allows us as caregivers to start asking questions and start looking for more solutions. And,
I'll make one comment because I think it would help your listeners
Mhm.
is if they want to think about it, you have your typical primary care and there are probably primary care providers that will see patients in the home in your community. But if you're going to ask about a service that's higher acuity, next level up, you could ask about urgent care in the home. Now,
Right,
my particular company, we're doing higher acuity than urgent care at home, but I think that's a really good starting point for your listeners to at least inquire and say, is there urgent care in the home available in my community? And from there, you can start asking questions. Are there even higher levels of care available? That's
right.
that's a good way to bridge into it.
Yeah, I love that. I love that. And for those people who, you did give a few examples, but let's go deeper into, let's say, the difference between an urgent care and high acuity. Like, how would you define or give examples of high acuity?
So I would say high acuity would be things like I had mentioned, like
Mhm.
congestive heart failure, exacerbation, COPD, DVTs. We can do things like suturing and different things like that in the
Mhm.
home. UTIs are a big one. Dehydration. You have a lot of folks that have different kinds of like chemo or things
Right,
like that that are going on. They get dehydrated. They end up in the hospital. A byproduct of what we do in the home is you are not going to the hospital to be surrounded by a bunch of sick people when you're
right,
immunocompromised. That's a big deal,
right,
right? So it's all of those kind of things that we can do. The way I look at it is if you have something that is immediately life threatening, don't call us. Go to the ER. There's a
right,
reason. There is a hospital and you should use it for certain things, right? If you have a traumatic injury, head injury, and you're on blood thinners or signs
right,
of a stroke, drooping, or a heart attack, go to the ER. But there are a lot of things. If you have time to think about whether this is immediate life threatening, there's a chance that it's not. You can call a service like ours and we can help triage you over the phone and let you know whether we think it's appropriate or not. So
right.
there are just so many things. And we bring in things like, we can do stat labs, which
Mhm.
means labs that are very quick. We do
Yes.
point of care testing. We can do imaging in the home, EKGs, all of those kind of things. We can bring oxygen concentrators into the home. We
Mhm.
can even leave them if we need to. So many things that we can do that just weren't available a couple of years ago. And you asked how this all started. This company was founded by ER physicians. I am not an ER physician. I'm
Mhm.
actually the second CEO in the company's history. The original one, Jim, is an ER physician, and Jim is fantastic. And what they found was there were just so many patients who were going to the hospital, spending their 4, 6, 8 hours in the ER for things that just could have been managed at home.
Right.
And that's really how this got started. And a beautiful thing that I didn't mention before is we can provide this care at a fraction of the cost of what it
Mhm.
costs in a hospital. I mean, your listeners don't think about it this way, but I do because I'm a business person. If you're a Medicare patient, you go to the hospital, it probably costs triple what it costs for us to
Right.
deliver that care. If you're a commercial insurance patient, which is the typical what I would get through my employer, that kind of it's probably
Yeah.
6 times more
Yeah.
expensive to go to the
Wow.
hospital than it is for us to do this. So the byproduct is you're getting care where you want it, and it's saving everyone money, including yourself. Usually, it's just a copay of a specialist type of copay for this kind of
Yeah.
service.
That is amazing. I've been thinking, like, the whole time you're talking, you mentioned a couple different times the whole UTI thing. Like,
Yeah, it's a big one.
every caregiver listening to this that is caring for an elderly parent is like, oh, that would be a game changer, because that is something that comes on fairly, a lot of times you don't know it's happening until they're already, their cognitive decline is rapidly
Exactly.
decreasing, and you're like, what has happened? All of a sudden there's that kind of thing. I also know that, my mother had so many different issues. We were going the last 5 years of her life, we were in and out of the hospital 35 times. And of course, most of those went through the ER. And now some of those would have ended up in the hospital anyway, right? But there were many times where we were just going to the ER because it was the middle of the night, or it was, off hours, or we couldn't get in touch with the doctor and we weren't sure. And because of all those things. But to your point, she was immunocompromised. And so every time it was, one of those decisions where it's like, there's no good decision here. We're just gonna have to do the best we can. But I love that, one, there's so much that you can do, and two, that it is a reasonable, that you're not like paying out of pocket for a home chest X-ray.
Right.
It's not the
And
same.
those kind of things can run right through insurance anyway.
Right. Yeah.
So yeah, exactly. It's not your typical cash pay type of service.
Right. Right. Because that is happening also. There's a lot of like concierge care
Yeah.
that's opening up, especially in my area, which is great. But a lot of them are like, yeah, you pay, it's almost like a subscription. Like, you pay a subscription and then we'll do, but we don't take insurance, which is fine for here and there. But as when you're caring for somebody who has a lot of need, that doesn't really work as well.
Exactly.
So one of the things that I had on my list of questions is, and you kind of mentioned that when the company started, it was basically, there's people sitting in the ER that could be sitting at home and getting the treatment they need. Do you also feel like, and this is just an observational thing, I didn't ask you to pull up statistics before this, but do you think there is an increasing need for something for high acuity care in general? Or do you think there's an increasing need for at-home care, high acuity care, because of the wait times, et cetera, in the healthcare system?
So I don't know that it's either definitively, right?
Right.
Is there a higher need for high acuity care now? No, maybe during COVID there was
Right.
a bit of a bump, right? But I think that settled back a bit.
Mhm.
But I do think that there's an increasing need for care in the home, right? We've set up the system where anything that's higher acuity than like a sore throat, you have to go to the hospital for this care. And
Right.
everyone knows hospital-based care is expensive. And to be fair, we work with a lot of hospitals. We, believe it or not, we provide a lot of care for hospitals. A lot of them will come to us to help reduce readmissions. When they have a patient in the hospital and they go home, rather than have them readmit, they'll call us to go in and manage them and keep them in the home. But it's just, there's such a need for care in the home because, one, hospital-based costs are so much about just the facility fee, the
Right.
cost of being in a hospital. The second you remove that, the cost drops considerably. So the ability to move that care into the home, one, is better from a cost standpoint. That's just a little bit of it. But two, it's what people want. You
Right.
want to be able to be home. It's not just about familiar surroundings, which it is, but it's about being with your family. It's about being with your pets. It's silly. It's some people, it's about, I want to make sure my plants don't die. Like little
Right.
things like that stress people out. And if you have dementia or something like that,
Mhm.
game changer, because I feel like the worst place you can be is in the hospital for something
Oh,
like
yeah.
that. It's very challenging.
It's very scary. Another thing I was thinking about too is there's a whole generation of our parents. My mother certainly had to get over the not wanting to go to the doctor thing, but but like a lot of our parents don't want to go to the doctor. They don't want to go to so I think that, this also provides that opportunity for some people to be getting care that they otherwise just wouldn't even get. Like, they're not going to the emergency room when they need to. They're not,
Right.
that kind of thing. And so I think that's also an area where it can be more helpful for people who are, hesitant for just the principle of the thing. Like, I'm not going to the doctor. And it's like, okay, Dad, well, I'm bringing the doctor here. So,
Yeah.
we're doing it that way. So I think that's another place that's going to be very helpful as well.
I think you're right in a sense. Like, one thing we don't want to do is we don't want to provide a bunch of care that isn't necessary, but
Right.
that's not what you're talking about, right?
Right.
You're talking about, the way I look at it is, there are so many people, and especially, I feel bad to say it, a little bit of an older generation, they want to tough everything out, and I understand, but the reality is, if you wait a month or two or three for some of these high acuity things that flash themselves, all of a sudden you're in a very different situation. And, you may have taken years off your life. You may have increased the cost of care exponentially by waiting on certain things.
Right.
And that's why when something bad pops up, you want to understand what that is. Like I said, a company like ours, you can call us. We'll have a nurse talk to you and triage and let you know whether, and very openly, we'll get calls and we'll say, you'd
You
be
can
much
wait.
better treated in your primary care doctor's office. Why
Mhm.
don't we call and try and schedule that for you? Or here's an in-network urgent care. You have X insurer. We know that in-network is this one. Why don't you go there? Or wow, that's
Mhm.
really important. We need to get you over to the ER immediately, right? So
Right.
we're not just trying to see everyone. I want to make
Right.
sure that I'm being, at the end of the day, a big thing for me, I've been in healthcare for so long, is I really want to try and fix the cost of healthcare, which is it's just
Mhm.
spiraled out of control. And that means that I can't see everyone that calls us because I don't think
Right.
that's the right thing to do. The right
Right.
thing to do is to get people to the right level of care, whether it's my level or another level. End of
Right.
story.
Yeah. So you're not replacing the doctor that dad doesn't want to see, but you are, if he doesn't see the doctor when he could have seen the doctor and then it gets into an
Bad
emergency
situation.
situation, then Care2U can help or get him to the ER.
Yeah.
Um,
And can I mention one thing I don't want to forget? We collaborate with your primary care doctors, right?
that's
And
so
your
important.
specialists. So after we know exactly who it is who you use as a primary care doctor, and after our visits and after we finish an episode, we're transitioning you back to them, and we will communicate with that doctor however they want to be. If the provider will talk to us, we will gladly get on the phone and walk them through the case so they understand it. Some of them want us to send over notes on the case and everything like
Mhm.
that. So we really make sure that your care is coordinated back to your primary care doctor. And if you're working with a specialist, like I said, in the case of you have cancer or something like that
Mhm.
and dehydration, we're going to probably talk to your oncologist or get that information over there as well.
Yeah, that is another thing that's very helpful because we are very fragmented in the healthcare system, where everybody has their own thing that they're working on, and so having collaboration and communication among the different providers is so important. One of the things that I have been talking about with people this season, with the different people I've had on, is the what happens to the information that you collect about patients. So like when I'm talking to a tech company that has some sort of monitoring device or something like that for loved ones, one of the things that I want to make sure that companies get a chance to do that are talking is like this is the information we have to collect in order to be able to do what we promised you we would do, and this is how we protect it, make sure it's safe, or transmit it to another place, all that kind of stuff. Can you talk a little bit about your privacy policy and that arm of things?
Yeah, sure. Certainly. Privacy is of the utmost importance. You can't operate in this business and not be very mindful and aware of that. So we're making sure that we're protecting that health information very carefully. And really, the only thing I feel like we're even monitoring is if you end up getting admitted to our service, we
Mm-hmm.
will very often, depending upon what kind of illness you have, we may set up a short-term remote patient monitoring just to be able to get things like weight and
Mm-hmm.
temperature and different things like that, just to make sure that if you are having anything that flares up, anything looks abnormal, that
Mm-hmm.
our providers are aware of that so that we can intervene quickly before anything gets out of control. That would be it. And that's just for a very short period of time.
Mm-hmm.
That's not a long-term kind of thing. So we our privacy expert internally is very heavily focused on that. We're not sharing that information externally. The only place that that's really used otherwise than to share that back to your primary care provider would be you need some of that for billing purposes to be able
Right.
to bill. And that's really the extent of it. There's no data selling or sharing or any of that kind of stuff going on outside of that. That's not a business we're in.
Yeah. Well, and for when I have found that people who have been in the caregiving space or in the healthcare space that are then branching out and creating these new types of care or types of tools, they tend to have a little bit more awareness of that issue than somebody
Yeah.
that's just like more on the tech side of things. So I love
Right.
when there's that collaboration within the company of we have our privacy person, we have our ethics person, we have our healthcare person, we have our technical, people, and we all work together to make sure that we're creating the safest, most effective service or product for our people. So it's refreshing to hear that, and thank you so much for sharing that a little
No
bit. Of
problem.
course, I will be sharing your website, the Care2U website, in the show notes, and of course all of your privacy information is there as well, so people can go check it out. Another thing that we talk about a lot with our caregivers and with our audience The podcast is called From Guilt to Good.
By the way, I love the name. Love the name. I think it's awesome.
We, as caregivers, we do carry a lot of guilt. We carry a lot of overwhelm. And I would imagine, and maybe you have some anecdotal, evidence or testimonies of this, but that having the ability to, keep your loved one at home more, not having to get them to the ER and all of that has to help with that overwhelm and burnout feeling. I know, like, me just listening to and reading about Care2U, I was like, oh man, this sounds so not stressful. And so maybe talk a little bit about if you have had any feedback to that effect, or how you do try to alleviate the stress in like the actual like experience of a caregiver or family member.
Yeah, so we do a lot for that. So one thing I'll say is when somebody works with us in our service, they have access to us for 30 days after that episode for questions. And, we get a lot of calls for that. I mean, I know this probably doesn't mean a lot to your listeners. It matters the world to me, but we get judged by something called the Net Promoter Score, NPS. And if you're in health, and it's from a negative to 100 to 100, if you're in healthcare and you're over a 30, you're doing something right.
Right.
We're north of an 85. So we're off the charts. And it's because people love the service and they come back. And that's because, we make sure that not only does the patient feel heard, but the caregivers feel heard, and that we're answering their questions and making sure that they get everything that they need. And we're helping them with, addressing needs that are outside of that, so we're doing everything we can for that. And it's funny, we talk about this about the home, but also, like I said, my mom's in an assisted living community, and we do that. We go in there a lot, right? Because if you think about it, in a community like that, there's nothing worse than the look of an ambulance outside all day long, every day. I mean, that can't feel really good for the residents. We come in, our cars say Care2U on the side, but it's still pretty discreet. They're pulling up in their Toyota RAV4s that have a ton of equipment in them. And they're going in and they're taking care of the patient in the home. And it's just a whole lot less distracting. It's like, stress level, maybe stress level 1 or 2, not stress level 9.
Yes.
Right. And I think that's a really big thing for it. Because getting someone out of the home, it's funny with my mom. If I want to take her out to eat, just getting her out it's not that she can't get out. My mom's very mobile.
Yeah.
But it's just getting out is the hard thing. Right. And she's in like physically in pretty good shape. So, anything that you could do to just make things easier on everyone, I think that care in the home makes a really big difference. And I've been doing this for a long time, and that's just really where my love is: seniors, care in the home. And we treat everyone 18 and above, and we probably will start going down below 18 years of age. But really, to me, this is really heavy for seniors.
Yes. And thank you also for mentioning that you are able to work with assisted living communities and other types of facilities. So that's really helpful. And I can totally imagine how they would be so grateful to have something like that that's in between, because they're in a situation too. My mom was in a long-term care facility, and they were wonderful. If anything, they have these certain protocols, and like if the number goes below this, they've got to call, like it's just the way it is. And so to have something that might be able to step in there I could see that would be very beneficial to them. And then I also know that, like you said, I can remember so many times pulling up to my mom's place and seeing, 1, 2, 3 ambulances or EMT, type things, and just being like having that quick, catch your breath moment.
Yeah.
It's like disconcerting for the caregiver. And then to your point, the people living there,
right.
Or also
it's a constant reminder.
Yeah.
And that's the thing. I talk to my mom every night, and she's like, I finally gotten to the point where I've come to terms with this is where I live, and it's a wonderful place. Like, everybody's so nice and so kind, but getting used to coming out of your house and living somewhere else, but then having that constant reminder of it's hard.
Yeah, it's really hard. Well, Lon, this has been a wonderful conversation. Like I said, I feel like we could have 47 more episodes on the different aspects of things that we've talked about today, but I do appreciate you coming on and sharing. I appreciate what you and the rest of the team at Care2U are doing. Like you mentioned, you're in New York right now, but you are looking into other places. So if you're in New York, check out Care2U. If you're not, still check out Care2U. And also start asking about this type of care, urgent care, in-home care that is beyond what, we're normally seeing right now in the space. Is there anything else that you'd like to share with our listeners today?
The only thing I'll say is go to our website and put, something in there, send something to us and let us know where you, and if it's something that's interesting to you, because if it is, and I know that there are people that are interested in the service, would be more likely to go there. So
that's a good.
We're debating where our next markets are, and we have a lot of partnerships with health insurers and large provider groups and everything. So it helps us expand very quickly. But I'd love to know where listeners are from and if there's interest in a service like this.
Okay, so you heard it from him. You guys are going to go to the Care2U website. I'm going to have that in the show notes. And then you're going to let him know where you are. And if you would like something like Care2U, which I'm sure you might. I mean, I definitely would have loved to have had this with my mom. And I'm hoping that you come to Florida. We
might be in the cards.
We have listeners all over. And so let Care2U know where you are so they know where to come next. Thank you, Lon, for joining me today. And thank you, everyone, for listening and watching today's episode of the From Guilt to Good podcast. To access the additional caregiver resources we discussed, to support our show, or connect with us on social, check out the show notes. We're changing the conversation around caregiving one episode at a time.